So, you're trying to study for the NCLEX and you're not quite getting it, right? You go to lecture, you get your notes, you get your presentation, it's all PowerPoint, and it still doesn't make sense to you when you go home. You know you took notes, you see it, you wrote it down, you highlighted everything, and it's still not connecting for you. Here's why. I'm Tiff Gibson, clinical nurse educator and certified nurse professional development specialist, here to help you on your journey to NCLEX, where I'm going to show you how to improve your NCLEX prep so you can pass the test. So, what do you do when you paid attention in school? You wrote notes, you highlighted, and you get home and none of it makes sense to you. Well, you first have to identify your learning style. Here's the thing. When you're in class, either personally in class, physically, or virtually, digitally, electronically, your professor has a timeline to get through certain content in the curriculum to make sure that you stay on track to end on time by the end of the semester. And so it's really hard for your professor to accommodate all the possible different learning styles that they are to make sure that you best grasp the information in the way that you need to in order for you to comprehend and understand. And so, as an educator, I know that the easiest way for me to give new content is to put it on a PowerPoint. Now, some people will read the PowerPoint word for word, which is utterly annoying, or they'll breeze through the content and then you get through the test and it's like none of this was on the PowerPoint anyway. As an adult learner, you do have to take some responsibility for your learning and getting new information and cannot put the onus directly on the professor. So here's what you can do. First, know your learning style. There are multiple different types of learning styles, but the three most common are visual, auditory, and kinesthetic. Now, as a visual learner, you like to read, you like to have things on paper, you like to rewrite your notes, you like to highlight, right? Which are all good things. One, I am a proponent of rewriting your notes because when you write it using your hands, you're more likely to remember it because you wrote it, right? Visual learners also like to color code things, which is great because certain concepts and topics will pop out to you and you'll group them. So cardiac will be red and respiratory will be blue and labor and delivery will be pink. And so that way you can kind of organize your notes visually so you know when you see something exactly what that content or topic is. Another thing that visual learners love to do, and you may not even notice this, but your environment has to be clean. Because you are a visual learner, the things around you will also visually distract you. And so be mindful about the environment in which you are studying because that's also going to affect how you receive and retain information. So if you're doing class online, where are you doing class? Are you in bed still with your pajamas on? Are you in the kitchen? Do you have an actual office? Are you going to Barnes and Noble? So you want to think about your environment because as a visual learner, your environment has to be visually appeasing as well. The other thing for visual learners is you're constantly having subconscious thoughts and talks to yourself and you don't even realize it. And I'm a visual learner, so I can definitely understand. When I'm reading the textbook, which is not how you study, not how you study, not how you study. But when I'm reading the textbook, I find myself having conversations with myself about what am I going to have for lunch or what's for dinner or I got to go to Target, right? Because all I'm doing is reading, which is very passive, and reading does not equate comprehension. Reading is just that. It's reading. And so as a visual learner, you need to engage in your content. You need to highlight key words, not key passages, not key chapters, right? Your whole page should not be covered in yellow. Keywords, they should be fragmented. Things that pop out to you, a definition or something that's important, a lab value. That's what you want to do. And you want to do this before class, either with the actual textbook or with the PowerPoint slides, hopefully that you get before your lecture starts, so that when you're in class, you're seeing the information again for the second time, and now it's starting to seep in. Because here's a tip. Adults need to hear things 5 to 7 times before it makes sense to them or before it clicks subconsciously. And so, as a student, someone who is active in their learning, you need to do the same as well. You can't just go to class and think you heard the information once and make sense. You have to reiterate it and see it multiple times, regurgitate it, okay? So you're going to read your text and or your slides before class. You're going to go to class, read it again. You're going to fill in the blanks with your notes. You're going to continue to highlight, star, asterisk, circle, whatever you need to do to let you know that this is important. And then when you come home, you're going to do the same thing all over again. That's at least 3 times. And I didn't even talk about studying for the test. That's just class and understanding class notes, okay? For my auditory learners, you like to hear things. Podcasts are your friends. You like music. You like to sing. You like to talk, which is great because guess what? Discussion is the number one way for you to put concepts together to enhance critical thinking. And so for you, working in a group setting, having study groups is going to be your friend. Talking things out, having a story behind it is going to help you put the pieces together. The other thing that's going to help you with understanding your notes from class is hearing other people explain it. Because sometimes, let's face it, your professor may not be your cup of tea, right? And they may sound like Charlie Brown's teacher, which is okay. So you may have to YouTube the same content, but have somebody else explain it to you differently. Or talk amongst your friends to see if you can fully understand it. Because here's the thing. You know that you are a master of a subject when you can teach someone else the subject and it makes sense to that person. So as an auditory learner, you want to hear things a lot. You also want to discuss things a lot. And the kinesthetic learner is the fun learner. You like to be fully engaged with your body when you are going through concepts. And so you may have to role play. You may have to draw things out. You may also be a combination of visual and auditory as well, putting it all together. You may have to move. You may like mnemonics where you're making songs and abbreviations to make things make sense to you, and that's fine. Understand your learning style so you can then incorporate your study style. But also note that just going to class is not going to be enough for you to understand nursing concept. Nursing school is hard as fuck. It's supposed to be hard. You're taking care of someone's life. You're learning everything you need to learn to comprehensively take care of someone's life. It's supposed to be hard. So understand that going to class one time is not going to be enough to understand these complicated topics. So I hope that helps. Thank you so much for watching Tiff's 2 cents, and where I'm going to help you prepare to pass the NCLEX. Stay tuned for more. Like, share, subscribe, and I'll see you around. Bye.